Welcome. November is Diabetes Awareness Month. This is a time to raise awareness about what exactly diabetes is and what strategies we can move forward to live healthier lives. So what is diabetes? Diabetes is a chronic health condition where you have elevations in your blood glucose or blood sugar levels. The most common type of diabetes is what we call type 2 diabetes. Now you have to first understand what happens in the body when anyone ingests food. When you eat food, the food that goes into your body enables the sugars in the bloodstream to go higher. Now, as a result of that, an organ in the body called the pancreas stimulates the release of a hormone called insulin. Now, here's why insulin is so important and insulin is key. Insulin is what allows the sugar in the bloodstream to be moved into your cells so that your cells can use that sugar, that glucose, as a source of energy. But here's what happens with diabetes. When you have diabetes, there's a problem with the pancreas secreting that insulin to help you move that sugar from the bloodstream into the cells. So diabetes is an issue with either underproduction of the insulin or your body just stops responding to insulin altogether. It's really an issue with insulin resistance. So when that whole process occurs, you now have elevations in your blood sugars, and that's when you really have the issue with diabetes. Those chronic elevations in the blood sugar causing you to have this chronic condition that can cause so many problems. So what are the symptoms of diabetes? There are certain symptoms that you really need to be aware of. Now, first symptom, if you have increased thirst, you're noticing that you're thirsty all the time, that can be a symptom of diabetes. Increased frequency of urination. If you find yourself running to the restroom to urinate all the time, that's also a symptom. Also, fatigue. If you're feeling tired all the time, you're feeling lethargic all the time, that's also another symptom of diabetes. Other things to look out for, blurred vision. You're noticing these visual disturbances, these visual changes. Also, you might notice that you have an increased amount of wounds or cuts that are not healing properly. These are a lot of the things that you need to look out for if you suspect there's an issue with diabetes. So if you are exhibiting symptoms, most important thing to do is go and get checked out by your doctor. Risk factors for diabetes. Now, this is really important because there are certain things that we know about that increase your risk for diabetes. One thing to be aware of is age. As we all get older, our risk for diabetes increases. So starting from the age of 45 and above, your risk for diabetes is going to increase. Now that's a risk factor that we do not have control of. We can't control the aging process. So as we age, we have to be cognizant that the risk is increasing. Another risk factor that we don't have control of is family history. What does that mean? That means if you have a first-degree relative, meaning mom, dad, or siblings with diabetes, that also increases your risk for developing this disease process. Other risk factors, sedentary lifestyle, meaning if you are somebody that does not get enough exercise and you sit around a lot of the time, that's going to increase your risk as well. So we do recommend making sure that you're getting an adequate amount of exercise to lower that risk. Another important risk factor, if you are a smoker, smoking increases your risk of developing diabetes. So you need to quit smoking if you are a smoker because your risk is going to magnify. So those are just some important risk factors to be aware of. And actually there's one more that we need to talk about. Another risk factor, being overweight or being obese. Now, being overweight and being obese is a concern because that can actually increase the issue or problem with insulin resistance and actually lead to issues with developing diabetes over the course of time. So you really want to have a healthy weight, remain active to make sure that your risk is lowered. So complications of diabetes. So one thing you need to be aware of when you have these elevations in your blood sugar levels, and your blood sugar levels, what we call glycemic control, is not taken care of, this can lead to the manifestation of certain complications. Now, these chronic complications include certain things like retinopathy, problems with the vision, basically. You can also have issues with what we call nephropathy, kidney problems. Other complications of diabetes, it can increase your risk for amputations. It can increase your risk for what we call neuropathy, nerve damage on account of diabetes. There's so many complications that can arise due to diabetes. And one of the other complications to be aware of, the cardiovascular component. So anyone who has diabetes, you are increasing your risk of coronary artery disease. You're also increasing your risk of potential heart attack, as well as potential stroke. So the amount of complications potentially that one can acquire over the course of time on account of diabetes, it's tremendous, the complications. But the key is really trying to manage your diabetes so that it won't even get to the point of heading towards the road of complications. We are diagnosing diabetes. So what happens when you actually go into your doctor's office and they are screening you for diabetes? There are a couple of ways that we can actually screen for diabetes and test to confirm a diabetes diagnosis. The first thing that can be done is something called a hemoglobin A1C. So when I have a patient coming into the office and they are being screened for diabetes, this is a piece of blood work that we check. This A1C, it's an average 3-month marker that lets me know where your blood sugar numbers stand over the course of a 3-month period. So when we get back the result, we are checking to see if you fall in the diabetes category, pre-diabetes category, or no diabetes category. Now the cutoff marks are important. If you have a hemoglobin A1C less than 5.7%, that's great. You have normal glycemic control. If you have a hemoglobin A1C between 5.7% to 6.4%, that is indicative of what we call pre-diabetes, meaning that you are at risk of developing diabetes. And then if that A1C comes back and that number is 6.5% or above, then you have been deemed a diabetic. 6.5% and above for a hemoglobin A1C is diagnostic of diabetes. There are other metrics and ways that we can actually screen for diabetes and diagnose it as well. A fasting blood sugar level. If your fasting blood sugar is 126 or above, then that can be diagnostic of diabetes as well. We also have something called a random glucose level. So if we check your blood sugar levels at any point throughout the day and we see that the level is 200 or above, that could be an indication that there is an issue with diabetes. But here's the bottom line. If there's a concern about diabetes, you really need to go to your doctor and get checked out so they can do appropriate testing to diagnose and move forward with a treatment or care plan so that you can move on with a healthier, happier life. Prognosis of diabetes. So guess what? Diabetes is not a death sentence. There are a lot of people who live with diabetes and are able to live healthy lives as long as they manage the condition accordingly over the course of time. What does that look like? This means that you are adhering to lifestyle modifications, meaning improving your physical activity, making sure you're getting the recommended amount of physical activity on a weekly basis. So it is recommended that you get at least 30 minutes of exercise 5 times a week. So that's at least 150 minutes of exercise weekly. And then we talk about diet. Healthy eating, healthy lifestyle with good, nutritious, healthy diet is really important. The things that you eat can spike your blood sugars, and there are other options to help you control your glycemic control as well over the course of time. So lifestyle modifications are key as well. So if you're able to monitor your blood sugars, adhere to the lifestyle modifications, meaning improve physical activity, healthy eating, prognosis over the course of time can be pretty good. We know that studies have shown us that if you are one who has diabetes, if you're able to maintain that hemoglobin A1C under 7%, your outlook is good in regards to having a healthy life.